Hey, everybody. Welcome back to Nurse Converse podcast. I am Cheyenne. I'm one of the hosts here with Nurse.org, and I am a certified nurse midwife. So, last time I had briefly discussed with one of my guests a little bit more about maternal health, especially when it comes to the Black community and maternal mental health, and just being able to be asking for support as a new mom. This time, I want to talk a little bit more about what an actual certified nurse midwife is and what we do, how I got to where I'm at, and a lot of the frequently asked questions that I get often. Just a little quick plug. This is Black Maternal Health Week of 2024. So I just want to encourage you to speak up for yourself, be an advocate for yourself if you are a Black mother, if you are pregnant or expecting, or if you have a loved one who is. Just want to encourage you to be an advocate, okay? So being a shoulder for them to lean on, making sure they are educated, you are educated, anything that you can do to help us in this fight of this crisis. Black mothers are still dying three times greater the rate of that of the white woman, no matter their economic, social, or educational status. So happy Black Maternal Health Week. Shout out to all the birth workers out there who are doing amazing things across the nation to help us with these numbers, okay? So yeah, let's just jump right into it. So I'm a certified nurse midwife. There are different types of midwives, but that is specifically my title. So that means that I hold a master's degree in nursing. So I have an MSN. It started out with a BSN. There are programs that go straight from BSN into your MSN without having like any gap. But I personally worked first with my BSN. I was a labor and delivery nurse for 6 years, and I've been a midwife for 2 years. So I'll tell you a little bit about my path. I don't necessarily know what called me directly to women's health, but I think I've always just been a feminist. I've always been that feisty, like, this is right, this is what women should do, and we should control our bodies, and I don't have to do that if I don't want to because it's my body. So back in high school, I went to a medical magnet high school in my hometown, which is South Bend, Indiana. So shout out to the 574. So back then, in order to graduate from this medical magnet program, we had to have a certain amount of volunteer hours. And I chose to do mine at the local maternity unit at the hospital there. And I fell in love with it. Like, I don't know what it was about it, but I was just like, this is it. Like, I like this. So my teacher in the program was also a labor and delivery nurse. So she had all that background and was a huge influence to me. So shout out to her as well, Mrs. Glaser. So if you're listening to this, thank you, girl. I really appreciate you. Love you. So then my senior year in high school, we got to kind of like choose this little internship, which is similar to like a capstone for nursing students. So you get to kind of like focus on where you want to be or something like that. And I chose to do mine with a local OBGYN doctor. His name was Dr. Lyons. So I am very, very appreciative of all that he taught me and all the experiences that he showed me. That was where I saw my very first vaginal birth. So I like to tell people that, fun fact, I passed out. So yeah. So, I mean, I passed out my very first vaginal birth and look where I'm at now. Don't let nobody tell you you can't do it, and don't let nothing stop you, okay? Because you can. Really was because I was hot. We just came out of a surgery and I didn't eat breakfast. So always eat breakfast before you like do anything, especially as a nursing student. Please, please, please eat breakfast. So then I knew that at that time I wanted to be in women's health, but I did not want to be a doctor necessarily because I didn't like operating. Like, I was like, I don't know if I could do this all day. Like, this is kind of a lot. I like to be more like with the patient, talking to the patient, not, when they're asleep. And so I just was like, this might not be my path, but this is my area. And that took me to nursing because, as you know, the nurses are with the patients so much, so much. So you get to build this rapport with the patients and, just get to be able to nurse them back to good health or nurse them during this stage of their life that's childbirth, things like that. So I knew I wanted to be a labor and delivery nurse. So after that, I went to school and I got my BSN, Bachelor's of Science in Nursing. And after that, I worked as a labor and delivery nurse for a few years and decided, okay, now it's time to go back to school. Not only did I work as a labor and delivery nurse, I was also a birth assistant at the local birth center here. And that really opened my eyes even more to certified nurse midwifery. I already knew I wanted to be a midwife, especially once I started learning about them, right? So I didn't learn about a midwife until I was already in college. Like I'd never heard of one prior to that. I was like probably in my early 20s, probably 21 years old, and I had just now heard of a midwife, which I think is crazy. Because first of all, I treat patients who are teens, like all the way up through menopause. So for me to have never heard of it, it's just like we have got to do a better job as midwives, as professionals, entrepreneurs, whatever. We have got to do a better job of getting in these schools, speaking at career fairs to these, middle schoolers, things like that, and showing them this amazing work that we do. So showing them what you do as a midwife, like that would have helped me so much if I had known what that was when I was in 8th grade at the career fair. So I encourage you, if you are in a school area or things like that, I encourage you to please go speak to these kids. If you get opportunities to be on panels, things like that, do it. It's great exposure for our field, and we always need more midwives. We need more midwives because midwives have proven statistics that we have better birth outcomes, and America is in a maternal mortality crisis, as I have said before. So anything to help. But anyways, got sidetracked. So after I, went to school, I got my bachelor's degree, and then I was working as a labor and delivery nurse in a hospital, as well as a birth assistant. So I got to see it from different angles. I got to see high risk labor and delivery in a hospital setting. We also did OB triage, postpartum, antepartum care, OB surgical care, things like that. So I got to see it from all angles there. And then seeing it on the other side at the birth center and seeing physiologic birth. So seeing what women's bodies are capable of was so amazing and so beautiful to me. And I knew that I couldn't just be a bedside nurse for that much longer, because I wanted to be able to have my own care plans with these women and these families and follow my more holistic path that I wanted to be on. So that took me to midwifery school. So I personally attended Frontier Nursing University, which is located in Hyden, Kentucky. It is an online program. It is a Master's of Science in Nursing. After you complete the program, you do have to sit for boards. So we are certified by the AMCB board, and it's like similar to like an NCLEX or something like that. Like you sit for your board exam, you get board certified, and now you're a certified nurse midwife. Yeah, so that is my journey. And then like I said, I've been a midwife for 2 years now and doing the amazing work that God has called me here to do. I always say that this is my purpose. Being an advocate for women is my purpose in life, whether it just be being a feminist, like you can do whatever you want to do, whatever you put your mind to. We are no less than a man. We deserve to get paid like our counterparts, all of the things. So that is just rooted in me. And so, my call to midwifery is an amazing journey. And everyone asks me, like, how did you know you wanted to be a midwife or not a nurse practitioner, or like FNP versus WHMP? How did you know you want to be a midwife? Well, I don't want to lose that aspect of catching babies and being with these families and these patients during their, most beautiful and sometimes most devastating or most critical time of their life of labor and childbirth. So none of the other specialties can do that. So if I wanted to be a women's health nurse practitioner, I still have that clinic aspect of it and the educational aspect of it, but I don't get that hands-on being in a birth, catching babies aspect of it. Same with FNP. I could have been, in the clinic, yes, but I can't get that hands-on catching babies getting to greet them as they're welcomed into the earth is one of my greatest joys of my job. So that's why I specifically chose the path that I chose. Um, and so I just kind of wanted to talk a little bit more about different types of midwives. So there are certified nurse midwives, there are certified professional midwives, and there are like direct entry midwives, which is not legal here in Indiana. So um, I'm not, I don't have a bunch of information on them, but certified nurse midwives are, in the state of Indiana anyways, able to work in a hospital setting. They're able to work out of hospital, like home or a birth center. Certified professional midwives, as of now, can work at home, but they are not allowed in hospitals or in birth center settings yet. Hopefully, those rules change. We are always working on new legislation and laws, and getting our agreements together here in the state of Indiana. So I hope to see that change here in the future very soon. But anyways, so yeah, CPMs can catch babies at home. They can do a home birth practice. CNMs can do home birth, birth center birth, or hospital birth as of now. And I'm personally working at a hospital right now. So we have a close collaborating practice. So I work alongside physicians and alongside other midwives, as well as nurse practitioners. And we have a pretty large practice. We have the largest midwifery practice in the state of Indiana. So I did choose to go to a hospital to have my first job. I don't know. I just felt a little bit more like comfortable, I guess. Like having that safety net, the OR's there, the doctor's right there. If I need anything, I got it. But out of hospital birth is very intriguing to me, and I love everything about everyone being able to be in their traditional element and, rooted back to how we used to give birth years and years and years and decades and ages ago, which was at home. That is beautiful to me as well, and so is birth center birth. So I do hope to be out of hospital catching babies someday, but just not yet. So stay tuned for that. So as far as school requirements go, certified nurse midwives need a master's degree in nursing in order to practice, as well as the board certification like we talked about. So you have to do your bachelor's first. Some people do an ASN and go straight to their bachelor's, which then goes to a master's. There are nurse midwives that I know who also have their DNP, Doctorate of Nursing Practice, but it's not a requirement to practice clinically. So a lot of people with their DNP have dreams or goals of being more at like a collegiate level. So they want to teach and be a professor someday. They don't necessarily want to do bedside. They may want to do research, things like that. But that is not required in order to practice bedside. So when I say bedside, I mean like you're catching babies, you're in the clinic, things like that. Will I get my DNP someday? Probably not. The verdict is still out there, but we'll have to see. I don't really think I need it right now because I'm doing everything that I want and dream of doing. But nothing lasts forever. So maybe someday I'm tired of catching babies and I'm burnt out of this, or, and I want to do something different, and maybe teaching is the next step. And then I'll consider the DNP. I'm not sure yet. Stay tuned again, because I surprise myself every day. So we just never know. So I did want to get into a little bit of FAQs. Okay. So I do get a lot of questions in my DMs, and I'm not always great about looking at them. So I'm sorry in advance. I apologize if you have DM'd me a question and I haven't responded. But hopefully this will get everyone's questions answered. I get the same ones a lot. One question that I often get is it difficult to find a preceptor for school? So I think that's a loaded question. I think it's depending on who you ask and what your relationship is in the community. Because for me, it was not difficult. However, I had been to, different events in the city. I had been working at a birth center. I was, involved in the birth community already. So I felt like I've already built these connections with people, and I was able to ask for that help of being their student. And also with one of the places I went, I was the first student. So, I wasn't fighting against all these other people trying to get in their spot. So it was a newer practice. So I was their first student, and I think that made it a little bit easier. So, I will say, however, I have friends who are NP students and midwifery students, and they have had struggles finding a preceptor. So my advice on that is to start early. So I know, like, for example, right now, we are taking students all the way up to the end of the year already. So it's kind of like you got to start as soon as you know your dates for clinicals and get it on the books, get the paperwork going, make sure it's a seamless, smooth transition and a smooth process for you, to get started early. That being said, a lot of people, a lot of practitioners have already got students lined up. So if you know you want a specific one, having that conversation with them, like, oh, are you going to be able to be my preceptor? I'm in school on this time, and having that relationship with them. So it makes it a little bit easier if you know them and have a relationship with them, rather than just reaching out like, hey, I need a preceptor. Here's my resume. Do you want me? Because sometimes we just look at those and be like, okay, I don't know. Let me read through this, things like that. And as you know, our lives are busy, just like your life is busy. So I say that to say, start early, build your community, build that rapport with someone around you, get out there in the birth world, make yourself known, build these connections, network, things like that. And I do think that it is a difficult thing for us. But there's always room for improvement. So if anyone else has advice, I would love to hear it. I have seen people post on, like, ACNM board, like job board or Facebook group or things like that. Like, hey, I'm looking for a preceptor. Here's what I need. Here's my information, things like that. So that's another way to reach out as well. Another question that I get often is, what is the difference between a doula and a midwife? So I'm sure you've heard of doulas before. I love, 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 love doulas. So shout out to the ones here locally in Indianapolis. I love y'all. Keep doing amazing work. Hire you a doula. If you're pregnant and you're listening to this right now, hire a doula. Okay? So doulas are amazing people who help support you through pregnancy, through labor and childbirth, and through the postpartum period. So sometimes they're there with you during, your labor and your birth. They're helping you with different things, like they support you and your partner. They help you in different positions. They may help you with meals. They may encourage you to eat and move, which we like to do in labor. They may encourage you to rest, which is also what we like in labor. They might help you, rubbing your back, or, giving you some essential oils to help you calm down. They may help you with different breathing techniques. They're a great support person to help you through labor, especially unmedicated birth. And there's also something called a postpartum doula, which I find to be absolutely amazing, very, very valuable. And if you can't afford both, or the doula that you're going to choose is only able to do pricing for one or the other, postpartum doula is extremely, extremely helpful. So they can help you meal plan and get meals ready for, lined up at home. They can help you with the baby, especially like during those few nights and you don't have family nearby, things like that. So get you a doula, okay? They are an amazing asset to our team. However, they are not clinical staff. So that being said, I'm a provider, so I provide clinical care. I actually catch the baby. I see patients during the clinic when they're still pregnant. Doulas may see you during pregnancy, but they do not do clinical work typically. So that means, like, they're not going to be the ones with the, like, catching the baby and things like that. So you ideally need both. You ideally need a doula and a midwife. But a doula is something optional, and it is becoming more popular and starting to be covered by insurances. So although there's a lot of work to do there, Doulas can be covered now, especially by Medicaid. So we're always working to do greater work about bringing doulas onto our team. But yeah, so doulas are not clinical, midwives are. Doulas do not catch babies, midwives do catch babies. So I hope that helped a little bit, but I do think that doulas are very, very, very important. Um, Postpartum doulas specifically, I always say it takes a village to raise a child, yes, but it also takes a village to support a mom, especially a new mom, whether she be a first time mom or she's got other little ones at home. It takes a village to support her. So, however we can, we need to. And a postpartum doula is a huge help in that area. Another question that I get often will be, did you work during school? Now I'm gonna tell y'all something. My whole life, I've been grinding. I've been a go-getter. I have always had at least one job since the day I could get a job. So I've never taken time to not work. And also, like, I live here locally. I don't live with my family members. I went to school later in my, late in my 20s. I graduated when I was 30 years old. So I already have a house. I have a mortgage to pay. I can't just not work. So if you're afforded that availability and you're able to financially not work, then that's great. Please, by all means, take the time off, especially once you're in clinicals. Because clinicals, for me, they want you to do 25 to 30 hours a week. Now, I still worked full time as a bedside nurse, and I was also a travel nurse. So it was a lot of bouncing around for me, and it was very, very, very difficult. I say that to say I do not recommend you do what I did. I used to work 3 days a week and I would have clinicals 4 days a week. What does that leave me? 0 days a week for myself, 0 days a week for self care, 0 days a week for vacation. I mean, it was a long 7 to 8 months of clinicals for me. I was like dying and drowning. I always recommend, even if you can just go part time or PRN or 1 to 2 days a week here and there, anything that can help take that load off and help you focus on school, focus on clinicals, that would be ideal. But not everyone's life is set up like that. So do what you got to do, grind it out, know that there is a rainbow on the other side of this storm. But I personally worked all the way through school full time. I do think that, working while I was in school was helpful. In some ways, I find it beneficial that I'm seeing this stuff that's happening and I'm learning about this stuff that's happening in a textbook. So it was nice to be able to relate and like connect the dots that I'm seeing at work. So that was helpful. Another question I get asked often is, what does it look like day to day? So for me, my practice, we have a clinic that we work in, which is like your office visits, and we work at the hospital as well. So in clinic, I might have 20 patients on my schedule. Sometimes I might have 15 patients on my schedule. It kind of depends on where I'm at, how many other providers are there that day. So I may see pregnant patients. I don't have to just see pregnant patients. I also do full scope gynecology care. So I'm doing pap smears, annuals, STI screening, STI treatment, all forms of birth control, removing birth control, period issues, menopause, perimenopause. We do the full scope. So I may have a variety of all of those different types of visits on my schedule in one day. Then at the hospital, we only do OB care there. So I will see patients in the OBED, which is kind of like where we triage them. They may come in because their water broke and they're in labor. They may come in for vaginal bleeding during pregnancy or things like that. And then they get admitted and we see them during their labor process. And then I also get to catch their sweet babies. And then we see them postpartum, which is a time when we really do watch them closely, but also a great, great opportunity for education. So education is key for all pregnant women, in my opinion. What you don't know, right? So being able to educate them, make sure they have good support at home, make sure they know the warning signs for anything that could go wrong at home, make sure they're comfortable caring for their baby at home, make sure they're breastfeeding appropriately and there's no complications, things like that. So we do all of that. Another question that I get asked often is, what is your work-life balance? So that is a loaded question, honestly, because I think it's always going to depend on what practice you're in, whether you're at a home birth practice, whether you're at a birth center, whether you're at a hospital practice that does 24-hour call shifts, whether they're doing like we do 12 hours, whether they're doing you have to go in the hospital to take the call, whether you get to take call from home. So that's a loaded question, and I think it's just going to depend on your life dynamics. So I think it is easier with, specific set days, and we don't always have that. So, especially working with other midwives and they have kids, they might need Tuesdays off, or, like, it's just always going to depend. It's always going to vary. I think it's just going to depend on what type of practice you work for and how many providers there are in that practice. So, you have to share call. As you all know, babies come at whatever time they feel like coming, okay? Babies come at 2 a.m., babies come at 3 p.m. They come whenever, okay? So we have to have 24/7 coverage, 365 or 366 days a year. It doesn't matter if it's Christmas morning, and it doesn't matter if it's Juneteenth. It doesn't matter, okay? So we have to have coverage all the time. That being said, what about when people go on PTO, go on vacations, need days off, things like that? You have to account for all of that. So that may put you at taking a lot more call sometimes versus other times. And if you're doing call from home, that might be helpful, but then you have to be able to be called in at any time. So that being said, you have to have childcare. If you have children at home, you have to have things lined up no matter what. Or if you're doing call from the hospital, that's 24 hours that you're away. So you need to have childcare figured out for 24 hours, or someone who can, take care of things while you're away for so long, or things like that. So I think that's a question that's kind of hard to be quantified, if that makes sense. So I say that to say I don't have children, so I have a little bit more flexibility in that sense, but I do like to travel. I'm going to use all my PTO days, baby. I go on vacation. Okay, I think vacation is very, very important for my mental health. It is very important to keep me grounded and to not keep me like going to the point of burnout, which burnout for nurses, there are other episodes of Nurse Converse on that, and I highly recommend you watch it. But burnout is real, and I'm trying not to get there. So my self-care and my mental health, I'm going on vacation. I'm taking the trip, I'm booking the flight, I'm using the PTO, and I'm out. Okay. So I think it's very, very helpful to be able to be in a practice where you have more providers to cover, so you have less call. But every practice is kind of different. So I think that that's a great question to ask in interviews. So when you're interviewing for a job, a midwife position in a midwifery practice, it's probably one of the top 3 questions I ask. What does call look like? Do you have to be in-house for call? Do you not? Can you take call from home? Do you do 24-hour call? Do you someplace do a whole weekend of call? Do you have one weekend of call a month? Like, what does call look like? Because that's going to be a better indicator of what your home work-life balance would be. I'm big on work-life balance, so I don't even take my laptop home half the time. I get my charting done right there at the clinic or at the hospital. Even if I got to stay longer, I try to pre-chart for the next day, line up my patients in a row, because I want that work-life balance. When I'm home, I'm home. Anything that happened at work is still at work. Okay, I don't bring it in this door with me. I like my energy and my space to be sacred and cleansed. So yeah, what's for work stays at work for me personally. So I think that's an important question to ask when you're joining a practice. Let's see here. Ooh, this is a good question. So I get this question often: how much experience do you need before you become a midwife as a nurse? The answer is going to depend. Some some midwifery programs require you to have that experience to apply. Some do not. Some, midwife jobs want you to have some type of background in L&D before you apply. Some do not. I personally know an amazing midwife who went straight from BSN to MSN. She never worked as a nurse, and then she got out and got hired as a midwife. And she's been a midwife for 10 years, and she's absolutely incredible. I also know amazing midwives who are amazing L&D nurses or who are amazing doulas. They are also absolutely incredible. I did have some people in my cohort when I was in midwifery school who were like ortho nurses or med surg nurses or things like that, and they wanted to be a midwife. And it always did like kind of trigger me to be like, why? Or like, have you seen birth before? Or, things like that. So sometimes I did find that there was a learning curve that I kind of had. Like I could already read fetal heart monitors. I could already know like the normal, pretty much normal for like a birth or fetal heart tones or contraction, like things like that I feel like are kind of lost when you start med surg nursing. And I also found it very, very valuable. Like I tell people all the time, my 6 years as a labor and delivery nurse were one of the most valuable experiences of my life. I learned so much. I made so many connections. I got to like actually learn about pregnancy, birth, postpartum, family dynamics, which is huge. Like family is a part of the midwifery model. So you're treating the family as a whole. You're talking about whole familial wellness. And I was able to like study at work and like know what's happening physiologically was really helpful for me. And I'm glad that I did it right when I did it. So I personally worked, let me see, I worked for 3 years as a nurse before I went back to midwifery school. So I feel like I had a really good foundation there. I knew for sure, I knew before I went to nursing school that I wanted to be a midwife, right? But I knew for sure that this was my field. I had been, grinding in this field already. So I understood. I was able to see physiologic birth and see what certified nurse midwives do out of hospital when I worked for the birth center. So I feel like it was enough time. 3 years was enough time to get my feet wet, really get in there and learn what I was doing, know what I was doing. And so I think that's going to depend on you, like what you want to do personally. Some people just go straight through and they just become a midwife and they're great midwives. Like I said, one of my favorite midwives ever never worked as a nurse ever. She wasn't a labor and delivery nurse. She wasn't an OR nurse. She wasn't ED, nothing. She never worked as a nurse, and she's still an amazing midwife. However, I personally found my time working as a nurse valuable. So that's kind of to each their own. Another thing that I get asked often, and this will probably be my last question, is what advice would you give to a midwifery student, or what advice would you give someone who is thinking about going to midwifery school? And I personally feel like I have PTSD from school, from nursing school, from midwifery school, from it all. So half the time I'm like, more power to you. Godspeed. May the force be with you. Like, I don't know what to say because I'm still kind of fresh out. Like, I graduated 2 years ago, so I'm still kind of like, okay. Something that I found helpful for me was to be able to study with other people who studied like me. So I'm not a reader. I cannot just read a book and be like, okay, I know what I'm doing. Like, I need to listen. So listening to lectures, listening to YouTube videos, and also I'm kinesthetic as a learner. So like making out a study guide, typing it out, highlighting things, crossing stuff out, like that's how I learn best. So studying with other people who learn like you. That was helpful for me personally. One piece of advice that one of my preceptors and now my colleague and peer gave to one of my friends who is a midwifery student, she said, don't lose yourself in school. So focus on yourself and what brings you joy still just as much as you would be able to outside of school, because you don't want to lose that part and be so, focused on school and stressed out from school and you're not doing things for yourself. And I wish I would have had that advice when I was a student, because that was not the case for me. I was stressed out 24/7. I told you I was working 3 days a week, school 4 days a week. Like, my life was hectic, and there was a pandemic on top of that. So I did not do that. I had to find creative ways to get my anxiety under control. I had to find different hobbies. And like, if I would have just focused on self-care from the jump, I think that would have been really helpful for me. So I always tell people that piece of advice as well. It came from someone that I know and love, and I wish I had that advice. So that is another piece of advice. And I think that one more piece of advice I would say would be to get involved in the birth world. So if you are thinking about midwifery, but you've never, you know, you don't really know what it's like, or if it's something that you would like, try working on a labor and delivery floor and see if that's something that you like. Try working at a local birth center. Try working with a home birth practice as a birth assistant or a birth attendant, things like that. Try going to a doula training. Just being a doula and being able to, support women and support families during childbirth and labor is amazing. So seeing if you like that as well. But yeah, get involved in the birth world in the community that you live in. Other states are very, very great about this. Like, California has an amazing birth work community. I'm pretty sure Oregon does, Texas. Like, there are a lot of places with amazing supportive birth communities. So get involved, get out there, see what's out there. Ask people to shadow. If you're like, I don't really know, can I shadow you for a day? Do that. Um, Even like as a labor and delivery nurse, if you're like, I'm a nursing student, I don't know if I want to go into L&D, I didn't see it in my clinicals, ask to shadow. You can shadow an L&D nurse. I had nursing students shadow me all the time. I have friends shadow me. So that's also a good piece of advice. So yes. Overall, I like to leave this with making sure that you know your options. There are different paths to midwifery, and no one path is better than the next. We are all a team. So knowing that no matter what part of the team you are valuable, and your position is very, very important. And knowing that we all work for the patient. So we all work for this mother and her family. We all work for them. So allowing them to tell you what's wrong with their body or what's important to them. Like, I always start visits like, what's important to you with contraception, or what's important to you during your pregnancy, or what's important to you about this treatment of whatever we're treating. So knowing that the patient is the expert of their own body is very important. And thank you again for listening. I hope I answered all the questions that I always get. I hope I helped kind of give you a little bit of insight on what certified nurse midwives do and how I got here. And I hope I encouraged you to be active in the birth world and in the community that you live in to help us decrease these maternal mortality rates in the United States. Thank you. Bye-bye. See you on the next episode.